Hello, YouTube. Hello, my friends. It's Jill Osborne coming to you live from Santa Rosa, California for another National IC Support Group meeting. We do these normally on Sundays. Not 100% right now. I'm very congested, so we'll see how that lasts. The trees are blooming like the pine trees right there, killing me right now. You know that feeling you get when you have brain freeze, when you drink something cold and it hurts your sinuses? That's where I am right now. Anyway, listen, my purpose in doing these meetings is to make you so strong, so knowledgeable, so informed that no one can mess with you again. Nobody can demean you, diminish you, tell you that it's all in your head. It absolutely is not all in your head. It is real, it is treatable, and for many of you, it might even be curable. We don't even think about IC as a incurable bladder disease anymore. We think of it as a pelvic pain syndrome. Why? Because structures outside of the pelvis are often involved. Outside of the bladder are often involved, such as fibroid tumors, endometriosis, tailbone injuries, Tarlov cysts, et cetera, et cetera. So there can be a lot of potential contributors that are victimizing your bladder, that are giving you the symptoms of frequency, urgency, pressure, pain. Hello, Mary on YouTube. We are simulcasting live on YouTube and Facebook. So if I'm looking straight, I'm looking at Facebook. If I'm looking over here, I am looking at my wonderful friends over on YouTube. I'm so congested. Pine is the devil. Pine thing is the devil right now. So bear with me as I struggle with this. Hi, Boria. Hello, Ruth. Have to absolutely start this meeting by sending our love and support to IC patients in Ukraine. What is happening is devastating for them. Can you imagine being in the middle of therapy for IC? You're getting weekly treatments, and all of a sudden, everything stops, and you're in agony, right? You must understand that devastation in Ukraine is criminal, and may good prevail in the end. So we are sending all of our love, kindness, and compassion to not only the Ukrainians, but also the Russian citizens who do not support this, who are now being arrested by the thousands. You know, we would like to think that we've advanced as society. We would like to think that we've learned from warfare, that we've learned from World War II, that we have learned from the devastation that despots and autocrats cause, and yet we are still allowing them to conquer and harm and kill many, many people. I'm shocked by the number of people who support Vladimir Putin. Hello, come on. You can't protest in his, there's no free speech in Russia. You can be arrested. If you criticize Vladimir Putin and you're in Russia, there's a very good chance you're going to be arrested and tortured. That is the difference between between Russia and the United States and Ukraine. So let us all stand firm for Ukraine and for those IC patients over there who are struggling. So normally when I do these, I always start with like a 30-minute riff. And I actually do want to talk a little bit. I want to talk about two things. Number one, our last meeting I ended because I needed to work on our COVID cystitis website. Well, that is now live and active. COVIDcystitis.org has all of the research we have today on COVID cystitis, as well as our best guesses on how to treat it. So understand, for those of you who might be new to this, that COVID is not just a respiratory virus. It attacks the entire body, including the urinary tract. We have found live virus in bladders. We have found live virus in bowel months after somebody is recovered from their symptoms. Live, living virus. And so I see patients who get COVID, 75% report very, very severe flares that do not respond to traditional therapies. And many patients who have absolutely no history at all of bladder issues after COVID end up being diagnosed with IC because they're having COVID-associated cystitis. So we don't have a published treatment protocol. There's so much that we don't know about this. So we all have to eat a lot of humble pie. I would love to say we have answers. We do not have answers. From a therapeutic standpoint, we are going to have to do what we do for IC. We have to try to protect the bladder. We have got to create an environment that will support healing, that will reduce inflammation. So if you go over to covidcystitis.org, you can look at the treatment kind of algorithm that I put up that combines the IC and the overactive bladder AUA guidelines. And so that will at least give you a start. Alana says, you're scared for family in Estonia, which also borders Russia. Absolutely. And Moldova? Listen, Moldova's next. Everybody's saying for Ukraine. Exactly. Prayers for Ukraine. Ann says, called you Friday, New Jersey doctors. Did you get my message? You told me to call you. No, honey. If you called later, I haven't gotten it. I haven't listened to my messages this weekend. Alana says, flaring better now after taking supplements for 2 days. Yes. Okay. Now, the other thing that I wanted, so the IC network, we're kind of like the cystitis people, right? We don't just work with interstitial cystitis. We work with chemocystitis. We work with estrogen atrophy, genital urinary syndrome of menopause cystitis. We work with ketamine cystitis, and we work with radiation cystitis. And I want to tell you the story of a patient that I worked with on Friday who has radiation cystitis. Now, her case, so typical to so many of the patients that I work with. She was now in her late 70s, but her symptoms actually started in her early 20s, actually teenage years. And back then, she thought it was UTI over and over and over again. And I asked her, I said, well, did you ever test positive for UTI? And she goes, well, sometimes yes, sometimes no. And when I'm working with a patient like this, we always just have to kind of understand the past to understand the present, right? And so, so we go back in time to in her teens and 20s to try to understand what could be creating the foundation for her now very, very severe symptoms in her 70s. And, so one of the questions I ask is, can you remember any events which triggered your symptoms? Were there any traumas? Were there any pelvic injuries? Anything at all that you can remember? And her answer was, yeah, I had a really, really bad fall as a child, and I was hurt badly. Okay. So now we have the foundation for what has become a lifetime of challenges for her. So she suffered a very bad injury when she was younger. Now, the good news is she didn't have any of the related conditions, which is great. She didn't have IBS, vulvodynia, TMJ, anything at all like that. She didn't have sensitive skin. She didn't have a wicked sense of smell. So that's great. That's absolutely great that her central nervous system did not become involved. But I then asked her, I said, well, have you always dreaded going to the gynecologist because you knew that the exam would hurt? And she goes, yeah, definitely. And then, okay, has sex been uncomfortable or comfortable? And she kind of equivocated there, right? Sometimes it hurt, sometimes it didn't. And when a young patient struggles with long-term chronic muscle tension, a lot of things happen. So just basic lifestyle things. She was having, as an example, she had started having sciatica. So she had started having pain shooting down her legs to her feet. And I said, well, you do realize that that's because you have tight muscles, right? And she goes, no, she didn't know that. And I asked her, okay, do you struggle with constipation? She said, yes. Okay, can you start your urine stream right away? She said, no. That she has to wait 5, 10, 15, 20 seconds before she can release urine. And that's been a pattern for decades now. And so I asked her, I said, well, were you ever sent to a physical therapist? And she said, yeah, a long time ago. And I said, well, did you do anything? What did you do? And she said, well, we just stopped it. We didn't think it was helping. She said, I don't think it's my pelvic floor. And I said, well, hon, you have sciatica every day. You have pain shooting down your leg every day. Your pain is worse when you sit down. It gets better when you stand up. Everything is absolutely pointing to your muscles. But the other thing we had to consider, there were a couple of other issues. Number one, she had uterine cancer. She had uterine cancer 2 years ago, and she had a Da Vinci robotic hysterectomy. And we certainly know that after hysterectomy, one of the things that can happen is that you can end up with muscle spasms. And she was describing these terrible muscle spasms that would literally freeze her in place. She's like, Jill, I cannot move when this happens. And it's like, okay. So I explained proctalgia fugax, which is a violent spasm of the rectum. And I said, okay, is it rectal pain? She goes, no, it's very strong burning in the vagina. It's just bends me over. And I went, okay. So I explained to her what happened to me after my hysterectomy, that I had involuntary levator antispasms. And I explained all the symptoms. And she was like, oh, wow. So you've just described what I'm having. And I'm like, okay. So I think absolutely at this point in time, since you're kind of checking a lot of muscle boxes here, you certainly need to talk to your doctor to see if you can get a referral to a pelvic floor physical therapist. And you absolutely have to tell them, number one, you have this traumatic injury as a kid. Number two, you have consistent, persistent sciatica. And number three, your pain is in your vagina rather than your bladder. And number four, the spasms are so violent, they stop you in your tracks for 5 or 10 minutes that you literally cannot move. So that was one thing to ponder, is the fact that clearly her muscles have been involved for a very, very long time. But then, tragically, she got uterine cancer. And the therapy for her uterine cancer was radiation. And so she did not have chemotherapy. She just had radiation therapy. And so with this new flare that she's had in the last year since the cancer, we have to really look at, has radiation therapy exacerbated what's going on? So they did a cystoscopy. And what they found in her bladder were areas of bruising. So not Hunner's lesions. She did not have Hunner's lesions. She did not have bloody wounds in her bladder. What she had were very specific areas of bruising that her urologist said, that's the radiation. That's the effect of the radiation. You have the equivalent of a radiation injury to your bladder wall. So it's like, okay. So we got good news here. It's not Hunner's lesions. That's great news. But now we've got yet another traumatic injury. And so she was like, what do I do? And I said, well, radiation is challenging because radiation is damaging. It damages tissue, and it's really well known for damaging blood vessels. So, and I, again, you have to understand, just like with COVID cystitis, it's not like we have this really good published protocol. We really don't. So we have to kind of pick from the different guidelines, like the IC guidelines and the overactive bladder guidelines, and maybe the hemorrhagic cystitis guidelines, and try to map together some sort of something that she can do. So, she's crying on the phone. She's desperate for relief. The pain is terrible. And I said to her, okay, well, then you're going to have to start with the absolute basics here. So we know you have an injury to your bladder wall. So concept number one is not pouring acid on the injury. So are you following the IC diet? She goes, yes. I'm like, but you can't kid a kidder. I've been around for a while, and it's like, okay, so what do you drink in the morning? Do you have a cup of coffee in the morning? She goes, yes. And I went, okay, you can't do that. You cannot do that. She goes, well, it's half calf, and it's part half calf and part decaf. And I went, I don't care. You can't do that. If you have a wound on your bladder wall, are you going to pour coffee on it every single day? No. what would pouring coffee on a wound every day do over time? And she said, well, it would hurt more. And I went, no, it's damaging tissue. Your little wound is going to get bigger and bigger and bigger over time. So you are doing absolutely the single worst thing you can do for your bladder is drinking that 1 cup of coffee a day, because your bladder simply cannot repair itself. That little stem cell that is trying to grow in and repair the cell that's damaged on your bladder wall is destroyed every time you have a cup of coffee. So every cup of coffee sets you back 2 weeks worth of tissue healing. And she was like stunned. She's like, oh my God. And I'm like, yeah, you can't do it. That's one reason why you're in agony. So then she goes, so is the diet Sprite I have for dinner every night bad? No. Yeah, yes, it's terrible. It's terrible. And so she was not following the IC diet at all. And she was not looking at her bladder as injured. That's why I think it's really important that you think about this as injury rather than disease. Number one, because we're not finding as much evidence of disease as one would have thought. What we're finding more is traumatic injury, either to the bladder or the pelvic floor, et cetera, et cetera. So I feel very confident that we were in our conversation able to figure out the two things that were giving her agonizing pain every day. And I'm really excited for her, because I truly believe that once she locks down on that diet and maybe tries a few things, that she's going to get better and better and better. But you guys, you have to understand that one treatment will not work. Think about her case. She's had bladder issues for decades, most of her life. The underlying anatomy of her condition, of her interstitial cystitis, is very clearly pelvic injury from an injury in childhood. All the classic symptoms that never got treated, other than one short period where they tried to treat it, and I don't know what happened. Thus then exacerbated by having to go through radiation therapy, and also the fact that she was now in complete estrogen atrophy, and she was afraid to use topical estrogen. And so I sent her a couple of research studies to show that topical estrogen is considered pretty safe for patients who with a previous history of a gynecological cancer. So it's about creating a foundation for bone health, muscle health, tissue health, bladder health. That's our goal here. That is our underlying foundation and goal here. Mary here on YouTube says, I messed up last night. You drank some weird beer, just a couple of sips. Last night I felt for the first time that feeling of knives in my bladder. Today is somewhat better. I'm really scared. Mary, girl, I have to say that I went to we had a local little market open up in my neighborhood. It was fabulous. And on New Year's Eve, they were handing out little tiny cups of champagne. And this was back when my bladder was massively irritated and involved in the early 1990s. And holy hell, was that flare agonizing. And I only had like 2 sips of champagne. But when we think about alcohol in the bladder, we always have to focus on the alcohols that are lower in acid, and champagne tends to be pretty high in acid. So, and with the beers, what our research study shows is you need to do pale ales rather than dark brown porters and Guinness. So I happen to love Guinness. I love warm Guinness. The smells and the taste is fabulous in warm Guinness. But if you've got a vulnerable bladder, you're screwed. I've decided to go off alcohol for a while. I haven't had alcohol probably in 2 months, 2.5 months. Never drank a lot anyway. I mean, I would have a hard cider maybe once or twice a week. But I just kind of, I have a family member who's having some liver issues and some things like that. And we've just been looking a lot at various factors that can contribute to liver health, and alcohol is one of those things that has the potential to be quite damaging. And so it's like, okay, I personally want to take a step in the right direction too, and I want to try to eat as clean as I can, especially as we've been dealing with the stress of COVID, because the stress is real. Cindy says, more people get it from COVID. Maybe they will spend more time looking for treatment. You know, Cindy, here's the thing. You know, I mean, we've all known that things like erectile dysfunction get the most money and they get the most research, obviously, because men are making the most decisions for research funding and all that sort of stuff. And what I think the thing that might kind of help a little bit is this is difficult, but at the same time important. And that is quite a few of the men who get COVID, after COVID, they have really severe erectile dysfunction and they can't get it up. Or if they are able to get it up, their penis is actually like shorter, like 1 inch shorter. And to the guys watching, I apologize, but I'm just being real here. So, of course, a urologist immediately took notice because erectile dysfunction is a great priority in their clinics. And in that research, what they found was live virus living inside the meat of the penis, that there's live virus living in the penis in these men with erectile dysfunction. So that might be another way of getting more money towards COVID anyway. I mean, we're just learning so much. We know that COVID can cause long-term persistent inflammation in the bowel, and research with that is finding live virus in the lining of the bowel. We have, in all likelihood, in some patients, we're probably also seeing live virus living in the bladder lining, and it's been in the brain. It's been all over the place. Devastating. And they are mobilizing a special COVID task force for Ukraine because of everybody hiding in the subway shelters, and some of them are not masking up, and they expect a pretty significant a public health emergency with COVID, not only in Ukraine itself, but in the evacuees. Hi, David. Alana says, my dad has nerve damage from radiation and is having what I think of as symptoms of IC. Exactly, Alana. Exactly. And so again, with him, you can tell him the story that I shared. It's all about creating an environment to support healing of the tissue. So the most important thing for you to do with him is to get him off the coffee and off the soda and off of things that are irritating. Maureen says, what are bladder soothing foods? Well, here, let me pull up the list. Hold on a sec. You can find the list right on our website, which is icnetwork.org. icnetwork.org. And right in the main pull-down menu is a link called Diet. And let's see here. We have a whole bunch of big food lists in here. So the least bothersome foods are water, milk, your choice of milk, although I would be careful with almond milk because almond milk is high in oxalates. No research study has studied the effectiveness of the different types of milks on the bladder, but the almond milk is a no-brainer with the oxalates. In terms of fruits, bananas, blueberries, honeydew, pears, raisins, watermelon. I would be really cautious with the raisins because we have really big, significant research from our own FDA that the great majority of raisins out there are severely contaminated with fungicides and other chemicals, even organic. 100% of the conventional raisins, 96% of the organic raisins. So I have taken raisins out of our daily life. I do not buy raisin bread anymore, anything like that. So again, with fruits, bananas, blueberries, honeydew, pears, raisins, and watermelon. For vegetables, broccoli, Brussels sprouts, cabbage, carrots, cauliflower, celery, cucumber, mushrooms, peas, radishes, squash, zucchini, white potatoes, sweet potatoes, and yams. I should make some sweet potatoes tonight. I got a couple of big ones. My only qualification for that is if you are prone to gas, then you probably, have more gas cramping, especially if you got irritable bowel, I would throw out the Brussels sprouts and the cabbage and the cauliflower. Poultry, you can have chicken, eggs, and turkey. Meat, you can have beef, pork, and lamb. Obviously, we don't want you to buy any pre-seasoned, super hot, spicy, barbecue-y sauce, meat. You got to keep it simple. Seafood, shrimp, tuna, fish, salmon, grains, oat and rice, snacks, pretzels, and popcorn. I eat a ton. We're eating a ton of popcorn now in my house. A ton. Every afternoon, that's our snack, is a Fuji apple and popcorn. That's my snack. Hold on. Oh my God. Oh, gosh. I'm just dealing with this sinus thing. It's making me crazy. It's been 4 days now. And it's not COVID, it's just pine trees. Ugh. All right. What are the worst foods, the most bothersome foods? Coffee, regular and decaf, tea, especially green tea and black tea, carbonated beverages like Coke, non-colas, diet, caffeine-free, alcohols, fruits like grapefruit, lemon, orange, pineapple, fruit juices like cranberry, grapefruit, orange, pineapple, vegetables or products that contain tomatoes, flavor enhancers, which are hot pepper, spicy foods, chili, horseradish vinegar, monosodium glutamate, artificial sweeteners like NutraSweet. Those are going to be your most bothersome foods. Good night. I have sinus burn. You know when you eat something cold and your sinuses burn? That is what my sinuses are doing right now. Terry Bartlett said installation was painful this week. It was on Thursday. I think it's now finally getting better. I will keep trying. Interesting. Hi, Carolyn. Thank you, honey. Nancy says I like amber ale, but the last 2 times I tried a sip, I got pain shortly afterwards and for days. So I have to know I don't dare drink it ever again. Well, not ever again, honey. I mean, right now your bladder's injured, and so while your bladder's injured, the last thing you want to do is pour alcohol on a wound. Give it a couple weeks, couple months, and then you're going to have to go back to a really, really pale ale and give it a shot again. Kayleen says, can you explain why my bladder hurts when it's full and not just the regular urge feeling? Well, Kayleen, that means that the nerves in your bladder wall, you've got 2 separate distinct nerves in your bladder wall. You've got alpha afferent nerves, which control frequency, urgency, and you've got C fibers, which control pain. Now, the C fiber is normally silent. It is normally not turned on, and it takes fairly significant trauma to turn the bladder pain nerve on. The alpha afferent nerve is the nerve that is supposed to be easy to turn on because it's the nerve that tells you when you're full and needs to pee. So at some point in time, your C fiber was hurt. And so if you have pain as your bladder and gets fuller and fuller and fuller, that means that that pain nerve has been turned on. Ann says, should I call you again on those New Jersey doctors? Ann, hold on a sec. I'm supposed to have oral surgery tomorrow. I don't know. We'll see if I'm well enough to do it. Oh, hold on a sec. Give me a quick second, Ann. All I know is I do not feel my best. All right, hold on a sec. Okay, Ann, I'm sending you back a screenshot right now. These are the doctors from the Harvard study. From let's see here. So, Ann, in our database, there's just a ton of physical therapists. And I can't take a screenshot of this. So go to our website, go to our Find a Doctor database, search by your zip code. Okay. And I'm seeing a lot of physical therapists and like Temple University, consultants in urology in Westfield, New Jersey, Turnersville, New Jersey, et cetera, et cetera. Nancy says, I'm learning a lot from the book, from your site, from the book and from your site, Breaking Through Chronic Pelvic Pain. I recommend it. Isn't it awesome? It's like a freaking excellent book. Hi, Bonnie. Hi, John. Lily says, what is your beverage? I've only drunk water for years. Okay, so this is an herbal coffee, Dandy Blend herbal coffee. I made a latte with it. No acid, no caffeine, completely bladder friendly. So if you want to try something that gives you almost that same sensation as coffee, try Dandy Blend. And that is this Dandy Blend. You can get this in the ICN shop or you can get it on Amazon. It's fabulous. Absolutely love this stuff. And then my other drink, which I had to stop drinking because it made my sinuses hurt more, was also what I normally drink, which is a Dandy Blend Frappuccino. But it's too cold and it gave me more sinus burn, which I don't need right now. Keelan says, would monthly installations still help then, or does this mean they're not working anymore? Well, I think monthly installations that can contain lidocaine would help calm those nerves down, those pain nerves down. Leslie said, did you say earlier that you had a bladder flare? What supplements did you take for it? Ruth says Mucinex or nasal spray. You know, I've been doing it, but you know what? Hold on. Let me go do it again. Oh. Okay. Oh, joy. Hold on a sec. Okay. See, what happened is we had 3 weeks where it was 70 degrees. See, the tree right outside my window here is blooming too. Oh, God. And then we're back down to freezing, and so everything froze again. And so the ecosystem in California right now is not friendly to anybody who has allergies. We'll see how long I last, guys. I might have to cut out early. Okay. Or hot steam from the shower. I already took a hot shower. Okay, so Anne, I'm sending you that screenshot right now. That's out of the Harvard database. Okay. Wash your face frequently. No, if I do that, you're going to see all my wrinkles. Believe me, a lot gets covered. Donna says, what estrogen cream is best? Well, going with just a generic estradiol cream is usually what's recommended rather than a brand name like Premarin. Premarin comes from pregnant mare urine, and it is, a despicable industry that keeps horses pregnant, takes their babies, and then sends all these mares eventually to slaughter. God only knows the other things, the practices that are happening in that industry. But the big problem with Premarin is they want a big shelf life. And so there's a lot of preservatives in it. So Premarin is known for causing a lot of extraneous irritation just from those preservatives. So I use, instead, for me, a preservative-free estrogen cream. My OBGYN, when I finally needed estrogen therapy, said, Jill, we already know how sensitive you are. We're not doing any brand names. I'm sending you right to the Women's International Pharmacy. You're getting a preservative-free formula because I know you. And Ruth says here, Premarin contains alcohol and burns. Yep. Tamara says, hugs. I have allergies and asthma too. Yeah, man. It is brutal today. First thing I felt when I woke up was my nose throbbing. Ridiculous, especially when you want to do things. I just sent it to you, honey. It's attached to the email. It's an attachment to the email. So you've got to click on the attachment. Okay, hold on. Oh boy. And Mary says yam-based estradiol, not soy-based. Okay. I did put up on our website a couple of new blogs. I think I talked last week about the UCLA study, which supports the pain subtyping system, that it's finding very distinct groups in the IC patient population, bladder-centric, non-bladder-centric, muscle-driven. You can read that blog on our website. Does chocolate irritate your IC? Of course, chocolate is well known for irritating because it is very provocative. It is allergenic. It also potentially has caffeine in it, known to contribute to migraines as well. So we have an option on things that you can enjoy, that a chocolate that is more bladder friendly, like white chocolate. The worst chocolate is milk chocolate. If you're going to do chocolate, you either have to do a really, really, really expensive, like Godiva dark chocolate, or do a white chocolate, or better yet, do carob. We have some fabulous carob products in the IC Network shop from, Oh Yes You Candy. That was the original name of the company. They're in Utah or Colorado. The coconut almond sea salt, carob bars, truffles, you name it, we have it. And this is the time of year when we can ship it, because when it's summertime, we cannot ship it. So if you miss chocolate and you want something different, come try some of the carob in our shop on the IC Network. Another article that I put up was an article on the microbiome. Just understand that everything that we know about the bladder is changing massively. That even 10 years ago, pretty much everybody thought urine was sterile, just like we thought the stomach was sterile. Everybody assumed years and years ago that no bacteria could survive in the acid of the stomach. And then this rogue researcher, I think in Australia, went, no, look, we have found bacteria in the stomach, specifically a Helicobacter pylori, which is known for causing ulcers. And he presented his research, and they scoffed at him, they laughed at him, they demeaned him, they insulted him. Nobody believed that bacteria can live in the acid of the stomach. Well, guess what? It does. And it's long proven. He is now a champion. We see kind of the same thing happening in IC. Pretty much everybody was saying urine was sterile, that the bladder was sterile, and it's not. It's absolutely not. They have identified 330 bacteria associated with infection in the urinary tract. And this is based on 70,000 urine samples. So I just want to read this to you. Renowned IC researcher Dr. Curtis Nickel gave a groundbreaking lecture on the importance of beneficial bacteria in the urinary tract and just how dangerous and disruptive antibiotic therapy can be. He said, "You are your microbiome. While it might only weigh 3 to 4 pounds, your body has more microbial cells than human cell. You exist as a vessel, albeit a fragile vessel, that provides a world for your personal microbiome population. Our microbiome keeps us alive. They are allies that support your health. They assure balance, homeostasis, genetics, digestion, as well as controlling your mood and energy level. Yet tragically, the use of antibiotics has placed great pressure on the biome and is causing an ecological imbalance in the human body, also known as dysbiosis." While the urinary tract was long thought to be sterile and was surprisingly left out of the Human Microbiome Project, new state-of-the-art next-generation DNA sequencing has changed that perception. He said, "The bladder and to a lesser extent the prostate and kidneys are a veritable microbial jungle." The first study, released in 2019, found 330 bacteria associated with infection in the urinary tract. Microgen Diagnostics gave him access to 70,000 urine specimens, which revealed more than 4,000 species in our urine. They aren't sure what a normal urinary microbiome is because antibiotics have changed our biome over time, but he believes that it is very diverse with clear differences between men and women. In fact, the MAP Research Network found significant diversity between genders, ages, and hormonal status. They are continuing that work with a new study that will follow 600 subjects. And where urine is sampled is important too. Researchers Alan Wolf and Elizabeth Mueller at Loyola found differences between microbiota found in urine, voided urine, catheterized urine, the urethra, and periurethra. They also discovered fungi and viruses in the urinary tract. IC flares were more painful in patients who had more fungal species found in their urine. Dr. Nickel had hoped that the research would reveal a hidden pathogen like H. pylori found in stomach ulcers that led to a Nobel Prize. In the MAP studies, there was no clear pathogen, but there were differences between men with chronic prostatitis and those without. One bacteria, Burkholder cynosepsia, emerged as a likely suspect, but they found 78 species in the prostate. Now, the link between microbiota and female lower urinary tract symptoms has been extensively evaluated. Urgent continence and overactive bladder have notable differences, yet they do not understand cause versus effect. Men with lower urinary tract symptoms show clear differences in their microbiota. Patients who are deficient in one species of bacteria, Oxalobacter formigens, are more at risk of kidney stone development. This bacteria helps metabolize calcium oxalates. When it is missing, stones develop. When it is present, the risk of stones is reduced by 70%. Dr. Nichols said, dysbiosis, imbalance in the gut, urine, and stones lead to urinary stone disease. And bladder and prostate cancer may be linked to dysregulation as well. So what do? Dr. Nichols said that we have to eat better, exercise more, and stay away from antibiotics and avoid environmental pollutants to support our microbial buddies. Fecal transplant is viable because it introduces good bacteria to protect patients from having UTI. Urine transplant may also protect against UTI by recolonizing the bladder with healthy non-pathogenic bacteria. He said this shows great promise, especially in patients with neurogenic bladder. All right, and then he talks a little bit about the vaccine. So anyway, you can read that blog on our website. That just got put up there. And, other than that, I went through all the research last week. Hi, Eddie. Hey, girl, how you doing? How are you feeling since Thursday? Okay, hold on a sec. Donna says, can you repeat the women's pharmacy again? It's the Women's International Pharmacy. Women's International Pharmacy. Their website is women'sinternational.com. Judy says, do antihistamines calm down the nerves in the bladder? Antihistamines do not act directly on nerves. What they do is they calm the mast cells down, because what happens, you get stuck in this vicious cycle. So let's say if you're IC subtype 1 or IC subtype 2, Hunner's lesions or bladder wall driven, we've got urine that's now penetrating into the bladder wall, and that's causing mast cells to release histamine. Remember, when you get a mosquito bite, that mosquito injects venom underneath your skin, and you know that it gets swollen and red. Why? And itchy, because the mast cells in the area release histamine. So that is one thing that triggers such irritation in the bladder wall. But the other thing that histamine does is it irritates nerves. And as the nerves get irritated, they release damaging substances which trigger the mast cells to release more histamine. So you get stuck in this vicious cycle of mast cells, neuroinflammation, mast cells, neuroinflammation. So while the antihistamine doesn't directly calm the nerves down, what it does do is it eliminates the one thing that irritates the nerves. So it will do it as a secondary effect. Denise says, estradiol 3 times a week has helped me so much. I have GSM. Excellent. Really good to hear that. Ruth says, inserts. I have the estrogen inserts. I'm going to ask for a low-dose estrogen patch as vaginal insertion, and urethral burn is an issue for me. Well, you know, are you saying, Ruth, that when you put a little bit of estrogen at the entrance to your urethra, it burns? And normally, I mean, that's normal if your skin is dry. I always have to warn every patient that I talk with, who, especially if you're older and you're just starting estrogen for the first time, it's going to burn because your skin is wide open. You have no protective coating in your skin. So it absolutely is going to burn at first. But it's not harming you. That burning is a direct reflection of the quality and health of your skin. Every subsequent time you use it, the burning gets better and better and better until finally the burning goes away, because that skin is immediately using that estrogen to produce that nice, thick, protective mucus. So, you have to ride through that first 2 weeks of irritation in many cases. My concern about going to the estrogen patch is that not as much estrogen is going to get where you need it to go. Now, remember, with the estrogen patch, you're putting it on your arm or on your thigh or wherever you're putting it. It's now going into your bloodstream, and it's being circulated throughout your body, including to your breasts, including to your ovaries. And that's where we see the greater risk of cancer. So that's very different from a topical estrogen cream, which will a cream which will stay in the skin superficially down there. So I don't know. It wouldn't be something that I would do. I use my estrogen cream on my vulva and at the entrance to my urethra and occasionally in my vagina. I would not, already having gone through the whole uterine cancer thing, which, as from our longtime users, you saw how that affected me. It was devastating. I would not do anything that would risk that again. Even though I have a hysterectomy, I don't want to have breast cancer, right? Lisa Smith says, I use Estro test cream. Good, excellent. She said it doesn't burn her. Denise says, I used a cream inserted with an applicator. It was really burning me, so my urologist told me to only apply half. Everything with me is half dose. Denise, that's very common. That's for me too. Heather says, have you heard anything about DRG therapy for pelvic floor? What does DRG stand for? Melissa says that she tried the Dandy Blend. Thanks for the recommendation. It's your coffee alternative. Eddie says she's seeing a new doctor that hope they give you, yeah, well, give it a shot, hun. So DRG therapy. Mary says, are you familiar with the therapy called solar therapy? My urologist presented this to me. Yes, I am. We did an article on it, and I swear, literally, yesterday or the day before, I found that article. Hold on, let me see if I can find it. Hold on one sec. Where is it? There was a time when I had everything memorized, but we have 20 years. We're starting our 20th year of our magazine, the IC Optimist, and it is no longer memorabilizable. However you say that. So I think it was last year. Let me see. Let me just see if I can find it. I just saw it like late last week. I swear I did. All right. Well, I did an article on it. Now you're asking me to remember? Okay. If I remember correctly, solar therapy. Here, hold on. God damn it. I don't like riffing on stuff. I want my facts. Right? So hold on. Like, seriously, Jill Osborne. So they have the website solarpelvictherapy.com. And it delivers an activating light energy that stimulates your mitochondria, the healing powerhouses within your cell. This initiates a powerful pain-reducing chain reaction that helps your body heal from the inside out. That's what they say. Average time to maximum pain relief, 4 treatments over 2 weeks. Dr. Angie Storr, somebody I tremendously respect, is look at this. Their top doctors are doctors that I know very well. Dr. Butrick, Dr. Storr, Dr. Coley. With solar pelvic therapy, you're not masking the pain, you're empowering your own body to break the pain cycle. Unlike traditional pelvic floor therapy, in which a physical therapist uses their fingers to stretch your tender pelvic floor muscles, solar therapy uses safe, proven light energy to activate healing within those cells. It relieves tender spastic pelvic muscles, improves circulation in inflamed muscles, and reduces pelvic pain. Okay, hold on. I swear that there was an IC study. Yeah, it was last spring. Okay. Oh, dear God. Come on. Okay. Here's my article. I had to Google to find the article, except the IC Network article. I didn't write it. Stacy, our writer, wrote it. So a news laser therapy seems promising for pelvic floor dysfunction. Solar therapy is the first infrared therapy to be used for pelvic pain, pelvic floor dysfunction. Since 2019, approximately 2,000 patients have received the treatment and 80% reported pain relief with an average of 4 sessions or 2 weeks. Solar therapy uses a class 4 near-infrared laser administered directly to the pelvic floor muscles via the vagina, also known as low-level laser therapy or red light therapy or photobiomodulation. It has been used to treat a variety of conditions, including dementia, dental pain, hair loss, osteoarthritis, tendonitis, and wrinkles. This type of laser therapy uses very low levels of heat that doesn't burn the skin. It also doesn't include damaging UV rays. Instead, it reproduces the good energy or light from the sun that causes the cells to emit extra energy, triggering a healing response. At present, the only data on the effectiveness of Solith comes from the company directly. Three related papers are awaiting publication, and abstracts will be presented at the 2020 Society of Urodynamics meeting in September. What we know so far, however, seems promising for IC patients who have struggled with PFD without relief from other treatments. As an emerging therapy, however, it may not be covered by medical insurance, and it is only available in some clinics throughout the United States. It's definitely a therapy option to keep an eye on as more research becomes available. There you go. So that was written on our website on April 15th, 2021. Hi, Donna. Kay says, I'm having a flare for over a month with severe urgency, tested negative for UTI, usually always do. All right, so Kay, question number 1 is, have you had COVID? Is this related in any way to you having COVID? Heather says, oh, she's posting the HFX, spinal cord stimulation, revolutionary pain device. Oh, dear God. Let's take a look at this. So, one of our questions is, what are the risks versus the benefits, the pros versus the cons? And okay, so HFX is a spinal cord stimulator and support services for somebody with chronic pain. It's to treat complex, dynamic, and the unique nature of your chronic pain. So in the American Urology Association guidelines for IC, neuromodulation is step 4. The reason it's step 4 is because it comes with risks of side effects. Interstim, for example, which is similar, which focuses on the bladder, has hundreds, if not thousands, of adverse events reported to the FDA. So this is what I want to know, and that is there a, let's just go right over to the FDA database and see, but I want to, I think I need the full name. Okay, hold on. So I'm going to go over. So what I'm going to do is I'm going to Google the MAUDE, M-A-U-D-E database. That's with the FDA. That is their medical device database. And now we're going to do a brand name of HFX. And I'm just going to do a search in the past year. It's not going to take the initials. Okay, the manufacturer is Nevro, N-E-V-R-O. Let me try that. Is this Senza? also, yeah, Senza. Oh, girl. All right. In the last year, there are more than 500 adverse events associated with this device. So the brand name is Senza. So let's just take a look. It was reported that the patient experienced increased foot pain. Multiple attempts were made to obtain additional information, but the cause remains unknown. Patient was hospitalized and remains under medical supervision. All right, that's the first one. That's from January 25th. Patient who experienced leg pain after the device. It was reported the patient acquired an infection. The patient was treated with IV antibiotics, and the device was explanted, in other words, removed. And that's what we see with spinal implants like this. Here's another one. It was reported that a patient underwent pocket revision. The manufacturer attempted to obtain medical assessment. So if you're considering any neuromodulation device, it's very important that you look at the published side effects, not just on the manufacturer's website, because remember, their job is to sell you something. It's helpful to look at the actual data. And here's somebody. It was reported that the patient had pain and acquired an infection. They don't say more. Is a patient who passed away from cancer. It was reported that a patient was experiencing shocking sensation. So one patient was getting shocked by her device. Here we go. Here's one of a device that was damaged. The device was returned and analyzed. Inspection as well as X-ray imaging confirmed fractured wires, but they do not know why wires were fractured in the body. Here's one, pretty severe. It was reported that the patient was hospitalized for potential infection. It was reported that this patient had weakness in their right leg following the implant. Patient was able to extend the leg at the knee, but had weakness trying to lift the leg at the right hip. The patient was hospitalized and then sent to rehabilitation. Okay, so again, just as we see with neuromodulation, with Interstim, a lot of side effects, over 500 reports in 1 year alone, Heather, device complications. I'm going to put in the link. Let me, at least here on Facebook, let me put in the link to the FDA database so that you can see it. Here, hold on a sec. All right. So here is the link right here. So Heather, go ahead and click on that and put in Senza, S-E-N-Z-A. And you can read all those adverse events for yourself. Kelly says, my urologist has prescribed me amitriptyline 25 ml for 7 nights and 50 ml for 7 nights and 75 ml. Is this dosage normal? After reading about the side effects, I'm very nervous. Well, there are kind of two schools of thought with respect to amitriptyline. If they're giving you amitriptyline for depression, it is very normal that they titrate up the dose like that to go from 25 to 50 to 75. Generally, in the IC patient population, we seem to do better with lower doses. And so it's actually fairly unusual for a patient to go up to 75. I've worked with a number of patients who have been at 50, but it is not my job to give you medical advice. I'm never supposed to get in between you and your doctor. I think you have the right to ask your doctor questions. The challenge with it, there are a couple of challenges with amitriptyline. Number one, it can mess with your heart. It can give you an irregular heart rate. So if you already get a rapid heart rate from allergy medications, ephedrine medications, epinephrine medications, then the chances are the amitriptyline is going to do exactly the same thing. When I took amitriptyline, I took it for 3 months. And so you gain 20 pounds almost immediately, like literally within the first month, bam, because it makes you start craving sugar. And then because you're craving sugar and maybe you're not as active as you would have been normally, you end up gaining weight. So we call it the Elavil 20. When you stop the Elavil, it usually goes away. It went away for me right away. But here's what it did for me. In your heart, there are 2 nodes. There's yes, because your heartbeat is beep beep, beep beep, beep beep, right? So you've got 2 nodes. Is it the SA node and the AV node? Well, anyway, whatever the names of the nodes are. So beep beep, beep beep, beep beep. But amitriptyline can affect the conductivity of the heart muscle, and what it did for me is it activated a 3rd node. So my heart rate went to beep, 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 beep. And sometimes if 2 nodes fired together, it was a beep, 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 beep. And it was scary as shit. So freaking scary. I wore a heart monitor for, I don't know how long, 6 weeks, 2 months. And it was caused by the amitriptyline. And I still occasionally, that node will still fire every now and then randomly, especially if I get stressed or if I get gas on my stomach. So amitriptyline is one of the harder medications on the human body. The other challenge with amitriptyline is that if you take it every day for 3 years, it is known for increasing your risk of dementia. Remember, the AUA guidelines is arranged with respect to adverse events, 6 steps of treatment. So step 1 is drinking water, changing your diet, trying supplements, muscle relaxation. So the American Urology Association says before you try amitriptyline, which has so many side effects, they say give some of the supplements a try because the supplements don't have that greater risk of side effects. They're considered effectively safer. So if we follow the AUA guidelines treatment plan, what they would say is, hold off on the amitriptyline first. Why don't you give Cystoprotect a shot or Cystomend or Bladder Builder or Bladder Rest and see if that has some benefit first. Kay says, I've never had COVID. I'm a double COVID vaxxed and I have a booster. Excellent. Okay, that's good. So, Kay, what happened a month ago? Did anything happen a month ago? Had you been traveling? Did you fall? Was there any event that you associate with the onset of your flare? Hi, Gail. Heather says, I'm supposed to meet with the Abbott rep. Interesting. So, Heather, I mean, this is kind of one of the things that's baffled me from day one about the medical devices and the reps, because you have to understand that the rep is paid by the company. And potentially the rep might even have an incentive to sell more product. And in many cases, reps are in the OR. And I'm very, very uncomfortable with that. I'm uncomfortable with having somebody who's getting a stake in it being involved with my medical discussions. I mean, if they want to come and talk to me about the safety, okay, power to them. I'd love to know about the safety. And Heather, I would specifically have your laptop, and I would specifically have the mod database up, and I would specifically go through all these adverse events with them. And there are some other very important questions you have to ask about it, and that is, Number one, how many surgeries on average should a patient expect to have? Oh, it looks like Facebook might have frozen. Facebook, can you guys hear me? Testing 1, 2, 3, Facebook. Can you guys hear me or did it freeze? It looks like Facebook just froze. Okay, so Gail can hear me. Okay, so my video. Hold on a sec. Okay, so my streaming software is absolutely working. Oh, there it goes. Okay, there it goes. Okay, so again, number one, I would want to know how many surgeries on average do patients have to have? There's an implant, there's a trial, then there's an implant, bladder revisions, and removals. Number two, I would want to know, is it covered by insurance? And I would get that absolutely in writing. Do not accept anybody saying by mouth it's covered by insurance. You need it in writing in your hand before you agree to have it done. And if it's not covered by insurance, how much will it cost? Number three, what kind of post-operative care would I be expecting to have with this? Will it have to be monitored every month, every 2 months, every 3 months? Because you have to add up the cost of that. Because if you're paying co-payments and you got to go in 4 to 5 times a month to have them check it, and you're paying $100 a copay just to see the doctor, that's a sizable withdrawal of cash right there, right? Number four, I would want to know, how long do the batteries last? Or what type of battery is it? Is it rechargeable or does it require replacement? Number four, does this device limit additional testing like an MRI? Number six, I would want to know, what are the average complications you see? And number seven, are those effectively treated? Number eight, has anybody ever had irreversible damage from it? Et cetera, et cetera. And honestly, Heather, seriously, you want to scare that guy? You bring up the MOD database and you go through 500 adverse events and you say, look at this. Clearly, this is not easy. More than 500 adverse events in a 1-year period? That's a lot. We need to know more about that. Okay, we're going to try the cold drink again. Let's see if it gives me brain freeze. Okay, so far so good. You guys, I have massive allergies right now. Borea says, what about hydroxyzine? Does it give you dementia too? It increases your ebb. Hydroxyzine does fall in the category of an anticholinergic, especially if you're taking more than one anticholinergic every day. The more you take, the greater the risk. Hey, hon, I took hydroxyzine for 10 years. I took a very, very low dose. I do not believe I have any signs of cognitive decline. Like, my brain is actually really together. Praise God. Hallelujah. Knock on wood. Ruth says, anything entering vaginally leads to burning, and I have not followed through with physical therapists. You know, Ruth, like, seriously, I totally understand where you're coming from. I mean, after my hysterectomy, I had so much pain down there. I would not let anybody look in my vagina for 10 months, including my OBGYN. I mean, he looked once at my post-op. And I had such bad pain for so long. It's like, oh, hell no. No, you're not touching me. You can stay across the room. No. But there comes a point in time when we have to try to understand why you're having such intense burning vaginally. Because if it's just dryness, which it's either dryness or it's muscle tension. Those are going to be the two most common causes of vaginal burning that you're having. So if it's dryness, they can treat the dryness, but it sounds, you could be extra dry. Thus, anything you put in there is going to burn at first. But you can take confidence in knowing that that skin immediately uses that estrogen to produce mucus. So the burning diminishes over time. You give it a couple weeks of estrogen therapy and the burning should go away. But if the burning is from your muscles, and if you have super tight muscles, and when you try to pee, you can't, you have to sit there 5, 10, 15, 20 seconds before you can release, or you're struggling with constipation, then, then a physical therapist would start externally trying to relax muscles externally, and then slowly working their way into the point where they can do some internal work. Karen says, what supplements are recommended? It depends upon your subtype, hun. If you're IC subtype 1, Hunner's lesions, lesions have to be treated correctly with lesion-specific therapy. So supplements in general really are probably not going to help a lesion, just like a bladder installation won't or Elmeron won't. Although I think taking something with PEA, palmitoethanolamide, also known as Peora, would probably help reduce some of that pain, possibly. If you're IC subtype 2, bladder wall driven, then let's say from estrogen atrophy, then doing something with chondroitin in it is going to make the most sense. So that's going to be Cysto Protect, Cysto Mend, Bladder Builder, Bladder Rest. And if you're struggling just with nerve sensitivity and pain, doing something with, again, PEA, palmitoethanolamide. So PK said, no, she's just been extra stressed. You've had IC since the age of 15. You're now 43. Comes and goes, but the urgency is especially bad this time. So Kay, so if we go back to when you were 15, which was almost 30 years ago, that's really, really important. That's really, really, really important, because the foundation of your IC today began back then. And what we're finding now for teenagers, where it started in your teenage years, like me, mine started when I was in 7th grade, when I first had frequency urgency, we're looking at muscle trauma. So did you have any bad falls when you were a teenager? Did you ever break your tailbone, fall on your tailbone? Were you an ice skater, a gymnast, a dancer, a cheerleader doing flying splits, a football player, any sort of athletics? Becky says, my psychiatrist suggested that I try Visceral for IC symptoms and anxiety during pregnancy. Yeah, wow, no, not during pregnancy. If you go to the IC Network website and go into our Pregnancy Resource Center, and let me do that right now. We've only had one research study published which talked about the risk of IC medications on a fetus, and it was done by Dr. Deborah Erickson at the University of Kentucky. So if you go to the IC Network website and you go to the self-help pull-down menu and go down to pregnancy, we have several pregnancy journals. We have Lisa's pregnancy journals. We have Melanie's pregnancy journal. IC patients have babies all the time. However, medication use is an issue. So the use of various IC therapies during pregnancy and their associated risk of causing fetal abnormalities is a complex question that can only be answered under careful consideration, research, and discussions with your personal medical care providers. Under no circumstance should you accept any other IC patient reporting that they used a medication safely during their pregnancy as a justification for you using any medication during your pregnancy. Each mother and fetus are unique individuals that will have their own vulnerabilities and drug sensitivities. No patient can guarantee that any medication is safe during pregnancy. In early 2007, Dr. Deborah Erickson and Kathleen Propert made an astounding contribution to the IC community with their journal article, Pregnancy and IC BPS, which discusses the use of common IC medications and medical devices during pregnancy and their potential risk for causing fetal abnormalities. They used a classification system that was created by the FDA. And A is adequate studies on humans which show no increase for the fetus. A B is animal studies which show no increased risk, or animal studies that show an increased risk, but human studies showed no risk. A C is no adequate human studies exist. Animal studies show an increased risk or have not been done. A D is human studies have shown an increased risk, but the drug can be used if the benefits outweigh the risks. And X is definite evidence of fetal abnormality exists. Treatments with this rating should not be used during pregnancy. So this article, we have a link of this on our website, so you can go to that and you can buy the article. We can't sell the article; it's owned by the publisher. Pentosane, Elmeron received the highest rating of B. But of course, now that we know that it's associated with eye disease, I don't believe it would receive a B today. I think it would be way down. Amitriptyline, hydroxyzine, which is Vistaril, and DMSO received C ratings. So a C means that there are no adequate human studies, and animal studies show an increased risk, or animal studies have not been done. Okay, so let me give you a link. Since that's a Facebook question, I'm going to post that link here on Facebook. Laylee says, hi, Jill. I want you to know that your knowledge saved me. A while back, I got diagnosed with IC after breaking my mom's fall. You said your bladder isn't getting enough blood. I did yoga and some exercises, and you're in remission. Have a few small flare-ups here, but nothing crazy. Thank you. Well, again, I'm so happy for you, Lily. I think that's fantastic. And you are just a perfect example of somebody whose symptoms became after some sort of trauma. If your symptoms came after a trauma, that's huge. Sherry said, I had side effects while on Vistaril. I gained weight and had vivid dreams. Yeah, the vivid dreams are why I stopped Vistaril. I started having night terrors. Gail says, I drink marshmallow root tea. Just know that marshmallow root tea actually bothers about half the people who try it. So it's not a given. All right, Kay. Thank you, Kay. So Kay's symptoms started at the age of 15. She broke her tailbone at the age of 14. Girl. Okay. So this is, I'll tell you where this comes from. Okay. You must get this book, Breaking Through Chronic Pelvic Pain by Dr. Jerome Weiss. It is the Bible for people with injuries like tailbone injuries. And the irony is, so this came out 2 years ago. And it's written by literally one of the best pelvic pain doctors in the country. He's now retired. It took him 15 years to write this book. It is a love letter to IC patients. It's just fantastic. Whoops. You can see it. I mean, it's really important that you end up studying this like I did, right? I mean, I should read this book twice a year just because I'll learn so much whenever I do it. So he talks specifically about the tailbone here, and tailbone injuries. Let me get my model here for a moment. So your tailbone actually plays a central role in the stability of your body when you're sitting and you're standing and moving. So look, here's the front of your pelvis, right? And remember, the way the human body is built is the bigger the bone, the more weight it's meant to carry. That's why your hip bones are so big, because it carries the weight of your torso, right? So you can see in the front, we have our pubic bone, and your bladder is literally sticking out right on top of the pubic bone. So for any of you who have pain to the left or to the right, it's not your bladder. Your bladder's centered. But let's look at the back. So here's the back. So here we have your lower spine. Then we have this triangular bone, your sacrum. And then off of the sacrum is your tail. This is your tailbone. And we just wrote a big article on it in our magazine. The magazine that is literally, I'm going to approve tonight, and it's going to go to the printer tomorrow. The article's called, Oh, the Mighty Tailbone. So the first thing that it's important that you understand is look at everything that connects to the tailbone. A ton of muscles connect and to the tailbone. If we look at it on the inside, look, there's your tailbone. You can see all the muscles that connect to it. The second thing you got to understand about your tailbone is that it is supposed to be completely centered. If it's not centered, if you broke it and it's crooked, if it's healed off to the right or to the left, or instead of curving under, it's curving outwards, then that is going to put tremendous strain on these muscles right here. So tailbone, so anyway, up to that point as a support group leader, now listen, I've been a support group leader for 29 years. I'm the longest serving support group leader in the United States, if not the world. I mean, I'm tied with Germany right now because we both got started in 93. We never were told to ask about tailbone injuries. Never, ever, ever. Until this book came out. And you know, my symptoms started when I was in 7th grade. I had frequency urgency. I couldn't sit through class. The teachers were annoyed. I kept having to go to the bathroom. And they called my mom, took me to the urologist. The urologist goes, oh, she must have infection. I still remember having to swallow 16 or 20 sulfas in one sitting in the doctor's office. And I was on antibiotics for years. And then they did urethral dilations where my urethra had gotten very, very small. And so it's like trying to pee through a needle. And so their answer to that was to shove a metal rod up there to open up the urethra. Nobody ever asked, why is her urethra narrow? Hello, the reason the urethra is narrow is because the muscles around it, and these are your levator muscles, these are the shallowest muscles. And so look, here's your urethra, here's your vagina, here's your rectum. The reason why my urethra was so narrow was because the muscles that were supporting it were super, super tight. Why? Because of the freaking tailbone injury. You know, just so anyway, I was a year ago, whatever, I was at one of the big pelvic pain meetings online, and we had a virtual meeting on IC, and there were about 10 of us there. Couple of the top IC doctors were there, a couple of other doctors were there. And I held up the book and I said, guys, you have got to get this book. This is an amazing book for patients. It is a masterclass in pelvic anatomy, specifically tailbone injuries. And one of the doctors there goes, Jill, we were debating tailbone injuries 30 years ago. And I went, yeah, but you never told the patients that. And he's like, you're right. We never told the patients that. So, Kay, I'm going to bet that you're just like me. I think that early on, after you broke your tailbone, you had pelvic floor dysfunction. And your muscles got progressively tighter and tighter and tighter. And what does that do? That restricts blood flow to the bladder. You've got ischemia. And that's going to cause frequency, urgency, pressure, pain. I'm also going to bet that when you go to the gynecologist, it probably hurts when they put the speculum in. You might have vaginismus. Has sex been comfortable, or has sex always been painful for you? When you go to pee, can you start your stream right away, or do you hesitate? Do you have any sciatica, pain that shoots down your leg? If you do, then you're IC subtype 3 pelvic floor driven. Now, you say you've had a flare for the last month, you've been under massive stress. What happens when you're under stress? You tighten muscles. You tighten muscles. That's what happens. Hey, for those of you on YouTube, you guys are being real quiet. Is everything okay over here on YouTube? Testing 1, 2, 3 on YouTube. Can y'all just say something in here so I can make sure it's working? Sylviane says she loves Bladder Builder. It has replaced Elmeron for her. That's great. Yeah, Bladder Builder. I truly believe the Bladder Builder is the best supplement on the market, and I'll tell you why. Where is it? Oh, here it is. The reason why I think Bladder Builder is the best supplement on the market is because it has the most methods of action. So it has chondroitin for the protective coating effect of the chondroitin. It's got quercetin in it for the antihistaminic effect of the quercetin. It's got some beneficial probiotics in it for the gut. However, if you flare when you take a probiotic, then you know we would say stay away from Bladder Builder. But the most important ingredient in this is palmitoethanolamide, PEA, which is known for calming nerves down. So this has 4 distinct methods of action. So it's kind of like your best bang for your buck, so to speak. We did a 1-year follow-up study. 60% of the patients who tried Bladder Builder were still using it. The 40% who stopped because either, number one, they couldn't afford it because it's in the $50, or number 2, their doctor wanted them to do something else, or number 3, they had a gut-related side effect, which is common with any supplement. But for the 60% who were still on it 1 year later, they reported fewer flares, less painful flares, and some were completely pain-free because of the PEA. And that really reflects the initial PEA IC study done in 2019. So I think Bladder Builder is a real interesting option. But if you're super sensitive to stuff, you know, you might want to instead go with Bladder Rest, which is kind of the formula that was created for people who were uber sensitive. And of course, you never take a full dose of anything the first day. You start with 1 capsule, see if your body likes it, et cetera, et cetera. And for those, the old standard try and true Cystro Protect, this is the new label if you haven't seen that recently. So Cystro Protect is back. It's been back for about a year, quite popular. So this is a viable option too. It's in an olive kernel oil base, whereas Bladder Rest and Bladder Builder are in an avocado oil base, which makes them a little bit easier to ship in the summer. Melissa says, can the bladder shrink in capacity with IC and the amount of urine it can hold? Only if your bladder wall is getting scarred and injured. Or if there's significant inflammation in the bladder wall. Remember, your bladder is a hollow sac, quite small, that as it fills with urine, it gets bigger and bigger and bigger until it can hold, 800 cc's or however much. Then you pee it out and it collapses in among itself, right? So generally, the way we see bladder capacity restricted is with really bad scarring. So if you have a lot of scars from previous infections, or you have scars from laser therapy for Hunner's lesions, that certainly would shrink your bladder capacity. There is something called the bladder holding protocol. The bladder holding protocol is designed to slowly but steadily increase your bladder capacity. It's kind of like timed voiding, where in timed voiding, they say, okay, you're going to pee every 30 minutes. Well, with the bladder holding protocol, they might say, okay, you're going to pee every 30 minutes for the first day. And then the next day, you're going to pee every 35 minutes. And then for a couple of days, and then go to every 40 minutes for a couple of days, and go to 50 minutes for a couple of days, and kind of work your way up like that. But there's a real warning with bladder holding protocol that you don't hold it into pain. It's really done by patients who do not have pain, because if you're forcing your bladder to be in pain, you're actually kind of activating the pain cycle. And that's you're just defeating the purpose, because when you're in pain, your muscles get tight to protect you from the pain, right? So bladder holding protocol is really done for somebody who doesn't struggle with pain at the same time. Susan says you have IC and IBS. Sorry to hear that, hon. I do too. I did. I can use past tense now. My IBS is completely controlled. Rarely do I have issues, and my IC is pretty controlled too. And so, Susan, our challenge here, number one, is to try to understand the underlying anatomy. The connection between IC and IBS is either muscle or nerve. If you struggle really tight muscles from breaking your tailbone or something like that, then the muscles are so tight they're restricting blood flow to the bladder and blood flow to the bowel, and that might explain why you could have bowel issues. Or we also know that the nerves between the bladder and the bowel are connected to the spinal cord. So we have something called the Pepperoni pizza algorithm, which was a research study that was done probably 12 to 15 years ago, where what they did is they irritated the bowel with pepperoni pizza, and they found that the bladder was irritated. And when they also found that when they irritated the bladder, the bowel was irritated. And that is because the nerves are merged at the spinal cord, and there's something called neurocrosstalk. So don't assume that they're unique, unrelated diseases. The odds are they're completely connected. We just have to figure out the connection. All right, so hold on a sec here. Okay. Katie says, my Elmeron is $580 something right now before my deductible. So, Katie, hopefully you know about the Elmeron eye disease issue. That they have now associated Elmeron with a retinal disease called pigmentary maculopathy that can cause some blindness. Some patients have gone legally blind because of their Elmeron use. So there are a lot of lawsuits going on right now. I got subpoenaed by the federal lawsuit about a month ago, and had to provide potentially a lot of documents. That's all in the attorney's hands now. You know, I'm not a party to the lawsuit. I'm just the one who told patients about the Elmeron eye disease issue, and then we did our own study. And I'm a little annoyed that I've now forked out some legal fees for my attorney to represent me in my subpoena. But it was the right thing to do, and I don't regret it. You had the right to know. Becky says, thank you. I'm planning to look into it. I really don't want to add medications during the pregnancy, but also my IC and anxiety are under control. So Becky, are you doing your stop sign, deep breath, minimize the thought? Are you doing that? Are you doing your really good mind-body medicine to try to get your brain out of fight or flight? We've done that several times. We have to get the anxiety under control so that we can get your brain out of fight or flight. Gail says, yeah, it's expensive. So I had to find other ways to treat my, well, people have been doing that for the last decade now because the price of Elmeron got so high. Anyway, that was before we learned about the potential eye disease. Katie said, I would get bladder infections a lot before my diagnosis. But Katie, you've got to understand the bladder only knows one language: frequency, urgency, pressure, pain. You could have a bullet wound and it would feel like a UTI. You could have a stab wound, it would feel like UTI. You could have cancer and it would feel like UTI. The only way the bladder can tell you that there's a problem is by giving you the symptoms of UTI. So yes, you thought you were getting a lot of bladder infections, but how many times did you test positive? Sandra said, I fractured my tailbone after a fall from a knee. Yep. Look at all you guys with tailbone injuries. See, I told you. Sylviane said, you've been such a great moral help for me through my hard times. Thank you. Oh, honey, you're very, very welcome. Kathy says, a cherry juice a flare starter? Oh, hell yeah. You know, if you're going to do fruit juice, you know, the lighter, the better, you know, and the riper, the better. I used to love cherry juice, and now that I have estrogen atrophy because I'm older, I probably wouldn't do it unless it was diluted massively with water, like 3-to-1 with water. And Sherry said you can't do Advil because of colitis. I don't do a lot of Advil either. You know, when I was playing professional tennis and college tennis in my 20s, I ate a ton of Advil for all the muscle pains that I used to have, and I blew out my stomach. So I can't touch. I might do one Advil pill a month at the most. I go for Tylenol. Peggy says, what do you think about D-mannose? D-mannose is irrelevant. All D-mannose might do is reduce the ability of E. coli to infect your bladder wall. But if you have estrogen atrophy, so if you have estrogen atrophy, then D-mannose makes a little bit of sense because it might help prevent a UTI because you are going to be more vulnerable to UTI with estrogen atrophy. But if you got chemo, cystitis, et cetera, I just don't see D-mannose being helpful at all. Glenda says, will expanding my bladder help with interstitial cystitis? Well, Glenda, I'm curious as how, you know, my 99-year-old dad obsesses about words and he drives me crazy sometimes. Okay. But your question makes me kind of do the same thing. So will expanding my bladder help with interstitial cystitis? Well, it depends upon what subtype you have. And interstitial cystitis as a word is kind of irrelevant to your question. The question is will expanding my bladder help with my symptoms? Frequency, urgency, pressure, pain, right? So what specifically are you trying to treat? Are you trying to treat pain? Or are you trying to treat frequency? Because remember, we have subtypes now in IC. Not everybody's the same. Remember, some of you, IC begins in childhood. For others, IC begins after menopause. For some of you, IC begins after having a baby, while for others, IC begins after breaking your tailbone. Not everybody's the same. So will expanding my bladder help with pain? So Glenda, where is the pain? Is the pain inside of your body or on the outside on the skin? So Glenda is on YouTube. She's asking these questions on YouTube. So Glenda, you have to tell me a little bit more about your pain. Is the pain internal or external? And then is the pain to the left or the right, or is it centered? So tell us a little bit more about that pain, hun. Inside of your body or on the outside of your body? Is it centered to the left or to the right of center? And if it's on the inside of your body, where is it? Is it in your urethra, your vagina, or your bladder? Sandra says, I thank you so much. You're an amazing resource of my strength. God bless you. Smarter than all the other. No, not really. I just live IC every day. Great work you put in, so knowledgeable, and you take the time to explain where the doctor, you know, that's ultimately why support groups and advocates and coaches are so meaningful, I think are so effective, especially if they have the right training, because we can take the time to explain stuff that a doctor just doesn't have time to explain. Okay, so Glenda says you have pain right when the pee is coming out. So is the pee in your urethra, or is your pee on your vulva on the outside? So as you're peeing, it feels like your urine is burning you on the outside. So is it in your urethra, or is it as it's coming out and crossing your skin? Amanda says, I had 4 C-sections and I have IBS and endometriosis and fibro. Just had IC added. You're recovering from a eating disorder and got handed a list of food to stay away from. Okay, so Glenda says her pain is urethral. So concept number one, it will help expanding your bladder help urethral pain. The answer is absolutely not. No. So with urethral pain, the very first thing we want to look at is your age, Glenda. How old are you? And you can just say decade. How old are you? And be prepared. I'm going to blow your mind. All right. So while you're answering that, I'm going to go back to Facebook here. So Amanda, with 4 C-sections, girl, you have had 4 significant pelvic traumas. You had the IBS and the endo and the fibro, which tells us then that whatever your originally injury was, we now have central nervous system involvement, which is causing the IBS and the fibro. Plus, we have to throw in that you've got endo. Your case is going to be a more comprehensive, more challenging case. I would certainly want to know what's going on with your pelvic floor. Is your pelvic floor muscles tight? After 4 C-sections, how can it not be? And I would also want to know what the state of your endometriosis is. And is there any chance that you have endometriosis attached to the outside of your bladder? Sandra says, do you have a favorite bladder calmer thing that you use? Well, let's just say, okay, so Glenda, you were diagnosed 5 years ago, but how old are you, hon? I need to know how old you are. It's a very, very important question. Okay, so okay, so Glenda, this isn't for you. This is for Sandra. I'm multitasking here. So Glenda, again, I need to know how old you are. Sandra, it depends upon what's the problem. If your bladder is irritated because you drank coffee, then you're going to have to do things. You're going to have to do our bladder wall protocol, flare protocol, where you drink water to dilute your urine. You might alkalinize your urine a little bit. Then maybe do a bladder numbing thing like azo, bladder pain relief tablets, or rescue and still. But if it's your pelvic floor that's tight, we're not going to do that. We're going to do something different. We're going to do things that are going to relax pelvic floor muscles. So that's going to be heat, a muscle relaxant, things like that. All right, Glenda, girl, I know I'm a woman too, and I don't like it when people ask me how old I am, but I need to know. Please tell me, how old are you? And you can just do the decade. Nobody care. I mean, we all care about you, but nobody's going to notice your age. When you're going to help other people, if my prediction is correct, you're going to help other people. Oh, it's come on, Glenda, give it to me. Give it to me, honey. How old are you? I'm 61. Are you older or younger than me? I'm 61. So just tell me. Oh, I haven't seen those replies, honey. They didn't come through. Okay, you're 36. Okay. Well, that just changes. That changes. Dang it. So I didn't see the 36 did not come through on my screen here. Okay, and you were diagnosed 5 years ago. You were at the age of 31. Did you have symptoms? When did your symptoms begin? Did your symptoms begin when you were a teenager, or did your symptoms begin in your 20s, or did they start suddenly when you were 31? Sandra, sometimes one of the things that you can do that can just chill the bladder out immediately is just chamomile herbal tea, peppermint herbal tea, or maybe some aloe, like aloe path. Where is it? Where is my aloe path? Here it is. You know, aloe can be calming and soothing. So something like aloe might be reasonable. Okay, so Glenda said it began right after your second IUD put in. Okay, and do you still have the IUD or have they pulled it out? You're not the first, hon. You're not the first. Amanda says, what about Uribel? Doctor gave me that and patted my leg and said, no PT pelvic therapy is needed. Just take it easy and relax. Oh my God. Talk about condescending. Yeah, just go ahead and pat you on the knee and say, oh, honey, you don't need physical therapy. You just need to learn how to relax. So Glenda, so we're really going to be looking at 2 triggering events. Number one is that we had a case study that was presented last summer of a woman who suddenly developed symptoms, no previous history, and over a period of a year, they got worse and worse and worse and worse. So she was diagnosed with chronic candida, she was diagnosed with UTI, she was diagnosed with interstitial cystitis, and she just got worse and worse and worse. And finally, at the end of that year, somebody mentioned birth control to her. Had she just started using birth control? And the answer is she had. Now, the challenge here is whenever you start limiting estrogen, you are in essence weakening the bladder wall. The bladder, you know, think about your bladder for a moment. It is the only organ in the human body designed to hold toxic waste because urine is body waste. It contains ammonia and urea. So how can the bladder hold ammonia for hours at a time? Well, the answer is that your bladder's like your mouth. It's a hollow organ covered with a really thick coating of wet stuff, of mucus. Your bladder is a mucous membrane organ, just like your vulva and your vagina and your urethra and a mouth. And that mucus acts to protect the tissue. Unfortunately, that mucus is estrogen dependent. So when you're young and you have lots and lots of estrogen, you have lots and lots of mucus, and you can get away with stuff, and your bladder is really capable of defending itself. But if you start using birth control, or as you're getting older and your estrogen levels are dropping, what happens? The mucosal barrier thins and your bladder's ability to defend itself is now compromised. And so in that young woman's case, she had started oral birth control pill. Well, when she stopped the birth control pill, it took 6 weeks and all of her hormones normalized and all of her symptoms went away. So I would really want to know, number one, did the IUD do that for you? Throw in the fact too that you didn't know that the lack of estrogen was going to make your bladder weaker, right? More vulnerable. And if you were a big coffee drinker or a big soda drinker or diet soda drinker, your bladder would not have been able to defend itself from that coffee and that soda after using the birth control. So some birth controls are stronger than the other. Some people are fine. Some people struggle. So that's one scenario. It's just a loss of estrogen. But the second scenario might be pelvic floor tension, especially if it was really, really painful. Somebody asked me years ago, and I think I did a survey on a specific type of IUD. Let me look and see if I can find it, because this comes up fairly regularly with patients who report symptoms beginning after an IUD. I don't remember. Hold on. Let me just log in and see if I can find it. Hold on. Do you still have it? I mean, you know, guys, you have to understand that. I mean, listen, I'm not talking from a religious perspective or anything at all like that. I think it's very important that we have control over our bodies. But the human body, the human female body is this estrogen-driven miracle. And when we start messing with hormones, there are long-term consequences that sometimes have to play. Like one of my friends took birth control for 30 years. Long after she had her children, she took it because it helped to control painful periods or something like that. And they found that her liver was filled with tumors. And they thought she had liver cancer. But when they actually biopsied the tumors, they were all benign. And they said it was from the birth control, a long-term birth control use. So, you know, so hold on. Let me just look through my old list here. Let me just see if I can find this IUD. We did it years ago. No. Yeah, I can't find it. Well, anyway, it certainly has come up. So you're not alone, honey. So do you still have it? Melissa says, can you have more than one subtype? Yeah, absolutely. If you're in pain, your muscles are tight. You know, so if you have Hunner's lesions, you're also going to have pelvic floor tension because Hunner's lesions are super, super painful. If you got bladder wall driven and your bladder screaming at you, then yes, your pelvic floor is probably bothering you. Ross says, where am I talking from? California, Santa Rosa, California. Fire country, baby. We're having fires almost every day now. Every single freaking day. They're small, thank God, but if you can look at our hills, they are that hill right there, which burned. They are probably there's only a little bit of green left in the hills now, just a little tiny bit of green. Sandra says, your pain is centered inside, always pressure, urethra, I think. I have constant pain at some level. You've shown your doctor our show. He thinks it's amazing. Awesome. Linda's having a bad day today. Linda, honey, I'm so sorry. What's going on? Ruth says, I can't be without Urabel. Sandra says she's 67. Amanda said, I had hysterectomy last April, and they said your endometriosis was on your ovaries. You still have your ovaries? Wow. You're having a doctor referral for a PT? Good. You know, hon, listen, hysterectomy is brutal. I had one. You know, the irony, yeah, I mean, you guys, you have to understand that I've worked with hysterectomy patients for decades. And I thought I knew, you know, I thought I understood the challenges that a patient who's had a hysterectomy goes through. Yeah, no, I didn't know. I didn't know crap till I had a hysterectomy myself. And holy mother of God, hysterectomy is rough. I mean, it's the hardest surgery you can do on a woman. You're basically taking out the core, the center her body down there, and there's a lot of blood vessels that get affected, ligaments which are cut, scar tissue, whether they take the cervix, whether they don't take the cervix. They took everything I had, and I had 10 months of really agonizing pelvic floor spasms. And you're like emailing your doctor, help me, help me, help me. It hurts so bad. But for me, it hurt when I sat down. It was like there was a hand up inside my vagina grabbing onto my fresh scar tissue where my cervix was. It was like I was pulling it out of my body, this very strong pulling sensation, especially if I sat down too hard or sat down in my car. And my doctor blew me off for months. He goes, Jill, it's just recovery. It's post-op recovery. You're healing, post-surgical, yada, yada, yada. Well, 10 months later, I was just beside myself. And I said, you've got to look at me. For God's sake, this is crazy. And so it put me in the stirrups. He looked inside and he gasped. He goes, oh my God. I'm like, what? He said, you're having involuntary muscle spasms. I can see your muscles quivering. And it's like, okay, what do we do about it? And he goes, well, we send you to physical therapy. And I'm like, sign me up. I don't want to live like this. You got to help me here. And he goes, well, I'm going to warn you, it's going to hurt. Most women drop out. It's going to hurt. And I went, I'm not most women. You sign me up. I'm very determined. And it took 3 physical therapy visits to stop the muscle spasms. Just 3. But he was right. The physical therapy itself was not that painful. It was walking out and sitting in my car afterwards that was painful. So the first 2 times I bawled in my car. I mean, your relationship with your physical therapist is a very nuanced relationship, because if you're not verbal, they're just going to look at your face. And I'm one of those people where I laugh when it hurts. But I mean, like, honestly, I didn't find the actual physical therapy that painful. If I had to rate it on a scale of 1 to 10, it'd probably be a 3. I just wasn't, I could do it. I was laying on my back. She was working internally. It wasn't that bad until I got up and started walking. That's when it hurt. So it took 3 tries and it stopped it. And I don't live with that pain anymore. So I'm really glad, Amanda, that you're going to go for a physical therapy evaluation. Very, very important. Very, very important. You can do it. Becky says, I'm 39 and pregnant now, but I started estrogen cream at the age of 34 due to vaginal atrophy. Wow. My doctor thinks birth control caused my vaginal atrophy. Exactly. And related urinary symptoms. You had been using birth control for 20 years. Exactly. Shayna says, she's doing well. Just wanted to jump on and reinforce that what you do here makes an immense... Oh, thank you, honey. Thank you for the 500 stars. Very much appreciated. Becky says, where do you apply it? Vaginally or on the vulva or at the entrance to the urethra normally? Boria says, I have pelvic floor dysfunction and Hunner's lesions. Very painful. So Boria, you need to pay attention to that patient study that patient case study that was published also last summer. And specifically, it was a woman with severe Hunner's lesions, with a severe prolapse. Her muscles were toast. They were messed up so badly that she was prolapsing. So they went in to repair her prolapse. And what they found was that her uterus was not anchored. It was floating. So the back of her uterus was facing front and the front of her uterus was facing back, because it was all swinging from one ligament because the other ligament was detached. And when they restored the proper position of the vagina and the uterus, her Hunner's lesions were completely healed. She's considered a complete cure. That's called posterior fornix syndrome, and you can find an article on that in our blogs on our website. Lisa said, my doctor wanted me to try Premarin cream when I applied it before bedtime and sent you into terrible vaginal spasms on the right side. Tried it again, and it did the same thing. Honey, Premarin is notorious for that. Premarin is notorious for causing issues. Normally, for the people who react to Premarin, you want to get a compounded preservative-free estradiol cream. So I get mine from the Women's International Pharmacy. It's a mail order pharmacy in Arizona. They don't pay me to say this. It was my own OBGYN who said, we're not touching Premarin for you. You're too sensitive. I want you to do a preservative-free formula. And the Women's International Pharmacy is a national leader for that. And it's cheap. Although they did just raise their price. It was $50 for a 3-month supply. Now it's $70 for a 3-month supply. Never had a problem with it. You do need to be prepared, though, Lisa. Now, listen, if you're bone dry down there, anything you put down there is going to hurt. It's going to hurt because you're dry. But so you have to ride through the first week or so. Every time you apply the estrogen, your skin uses it to produce more mucus. It'll take about 10 days to 2 weeks for that burning sensation to improve dramatically. What I don't understand, though, Lisa, about your case is, why were your vaginal spasms on the right side? I don't understand that at all. Why would it just be on the right side? Do you already have a pre-existing problem on the right side? Tight muscles on the right side? Shana says she uses estradiol directly on the urethra Monday, Wednesday, Friday without issue. Yep, me too. Rebecca says, my IC is my bladder wall. I